In the first video of this series, I went over what you would expect to have done in the neurological exam. And in this second video, I wanted to actually go over the neurological exam so you can see what it looks like. So that's what we're going to do today with Holly here. So Holly, first thing I'm going to have you do is I'm going to have you uncross your legs for me. And if you could roll up your pant legs to right about there. Yeah, if you could do that on both sides for me. So generally the first part of the neurological exam, as we talked about in the other video, although the order isn't so important, is the sensory part. So for the sensory part, can I have you go like this? And what I'm going to do is I'm going to roll this on one side and the other. I'm just going to ask you if it feels the same from one side to the other. So does this feel similar to this?
Yes.
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 And then we'll do the same thing down here. Does this feel similar to this?
Yes.
Good. Does this feel similar to this?
Yes.
Does this feel similar to this?
Yes.
And does this feel similar to this?
Yes.
Good. After the neurological exam, I'm going to have you uncross your legs again. Often what might be done is the reflex part of the exam. So the reflex part of the exam, just go ahead and just relax as much as possible. I'm going to have you put your hands like this. Just try and hold that position, but in a relaxed state. So the thing about the neurological exam, for a cervical complaint, they really should be doing the whole body neurological exam. For a lumbar complaint, they might only do a lower body exam, lower body neurological exam, although really they should do the whole thing in the ideal circumstance, as it really doesn't take very long to do. And it does provide valuable information. So that was the deep tendon reflex part of the exam. And next, what should be done, not necessarily in this order, but what should be done is the Pinsky Reflex, which is like this. And this is called a pathological reflex, and it's actually very important as it can tell us if there's something significantly wrong. The final part of the neurological exam, or the basic neurological exam, I should say, is muscle strength testing. So I'm just going to have you hold a couple different positions, and I'm going to try and push down and make you not able to hold the position. Okay? So the first one is like this. I'm going to push down. Good. I'm going to push down. And so the clinician is kind of trying to break your hold, and you really should be able to resist what they're doing. So the next one's like this, and I'm going to have you just hold that position. And then like this, same thing. And like this, I'm going to try and open your fingers, try and keep them nice and tight. And like this, I'm going to try and open your fingers, keep them nice and tight. Good. Now we're going to go to the lower extremities here. I'm going to push down and I'm going to push up. Good. Same thing over here. Good. I'm going to pull up. I'm going to be pushed down. Same thing over here. Good. I'm going to have you kick out towards me, back towards the table, out towards me, back towards the table. Whole foot in the air like that. Good. And now put your feet on the ground. Or you'll scooch a little bit forward here. And then just lift the big toe up. And then hold it. Yeah. Good. And so that's pretty much what the base neurological exam should look like. Certainly there can be more to a neurological exam. My normal neurological exam includes more than this, but you at least want to see these parts when going to a clinician and expecting them to diagnose you or treat you with a musculoskeletal complaint, especially neck pain and low back pain.